My condolences go out to the Cowichan tribes and particularly the families affected. This has been a crisis for half a decade now. Successive governments have put effort into this. We appointed a standalone Minister of Mental Health and Addictions. Minister Darcy will have more to say about the numbers today. I believe she's issued a statement. We're creating more treatment spaces. We have an act before the legislature that will help young people, particularly stay in hospital under medical supervision while they regain their faculties and decision-making processes are clearer for them. That's yet to pass the legislature, but we're doing everything we can to give parents some confidence that the Crown, the state, will do what we can to help their children when they run afoul of illicit drugs, currently illicit drugs. But this is a health issue, abundantly clear to me, and I think to the vast majority of British Columbians, and we need to tackle it as such. And that's going to require, again, national leadership, and I'm confident that the federal government will join with me once we move through this restart period and start to focus on the suggestions that are many throughout the community, not just the national police chiefs, but service providers for many, many months now have been talking about what we need to do to address this issue, and we're committed to doing everything we can.
Do you have a follow-up, Mary?
I do. Thanks so much. What specifically is the province doing to address this problem among Indigenous communities?
Well, we consulted with the First Nations Health Authority about the legislation that's before the House. We have worked with rural and remote and Indigenous communities to get more dollars into communities through the pandemic. Those can go to providing health care. We want to make sure that we're bringing health into communities. Telehealth and a whole host of other technological innovations are opening up doors for patients and for people struggling with addictions that weren't there before, but we need to make sure the technologies are in place and they're affordable for people and for communities, and we need to connect those communities with broadband internet service. This is an initiative that the government's been working on for a number of years. There's no one quick solution to this problem, but it's all of us working together, and most importantly, all of us recognizing that these people who are addicted to opioids are not criminals. They're patients and they need medical care. As we review the Police Act, which is just underway, we'll be able to look at where we can put resources to health care and the delivery of services for people rather than incarceration, litigation, all of the things that have slowed down success in our province. We want to make sure we're removing those barriers and giving people access to the services and particularly the treatment that they need.
Next question is from Tanya Fletcher.
Hi. Going back to the overdose crisis, you referenced it off the top, but putting the dual public health emergencies into perspective, you noted, 176 people died of COVID in the first 6 months of this year, and the same number of people died of an overdose in June alone. So how do you reconcile the province's differing responses to those who are criticizing that, the overdose crisis is being overshadowed by the pandemic?
Well, I just think that these are two separate things. We have an insidious virus that affects anyone at any time, and we have an opioid crisis that involves people using drugs. Those are choices initially, and then they become dependencies. So once people make those choices, they no longer are in a position to stop making those choices without intervention, without medical intervention. So I think they're two completely different things. The fact that the numbers are similar is a coincidence, but I don't believe there's anything we can learn from that. The COVID-19 crisis is a global crisis. We already see in the United States what happens if you don't follow basic guidelines. Too many faces, get a bigger space. Wash your hands. Physical distancing. Wear a mask if you can't do that. Those are conscious decisions people can make to protect themselves. When you're addicted to opioids, you're not making conscious decisions other than getting your next opioid. And those are issues that we need to intervene in, and we're doing our level best at a very difficult time. And the numbers are putting us back, no question, but there's a bunch of compelling reasons for that. The safe drug supply is not a safe drug supply, and we need to take steps to address that. Those are issues I want to raise with the federal government. We need federal intervention on the legal components of this in terms of decriminalization, and we also need a national plan, because although British Columbia is hit hard by this, we're not the only ones in the country.
Do you have a follow-up, Tanya?
I do, thank you. And you did mention off the top as well that the poison supply has intensified as the drug flow has dried up due to the border closure. So how do you fix that? Is there a plan to address that specifically, or what can be done about that?
Well, alternative therapies have been underway in British Columbia for some time. We need to reinvigorate that. And I'll leave it to Minister Darcy to lay out the details of our plans going forward. My approach to all of these issues is to put people in charge and ask them to do the work. And I know Judy's been working tirelessly on this. And we'll have more to say about these disturbing numbers from the coroner and our plans going forward. Partly, of course, the legislation that's before the House right now in terms of keeping young people in hospital when they present there so that we can get them to a place where treatment is an option. And then, of course, redoubling our efforts to make more recovery beds available, decriminalizing, and, of course, looking at making that drug supply safe so that we have patients that we can keep well, not people who are dying because they're being exposed to poisons that are being pushed by a criminal element. I don't want people to step away from this and conclude that the opioid crisis is not founded on a criminal element, because it is. But if you're addicted, you're not a criminal. You're someone who needs help, and I think all British Columbians want to reach out and help those that desperately need it.
Our next question is from Lisa Yuzda.
Hi, dear Premier. Just regarding the opioids again, I'll take it off speakerphone. Regarding the opioids again, you talk about choice. Well, there's people who are choosing to put themselves at risk of transmission from COVID-19. And when we look at the money that's been put in and supports and effort poured into stemming COVID versus the opioids, it's hard not to see that the lives of people with addictions are worth less than people with COVID. And I wonder what you say to those families, because it's hard not to see that.
What I say to the questioner, quite frankly, is that you can't compare the no one getting on public transit to an opioid crisis. No one was getting on public transit because they were fearful of a virus that we don't understand fully and that is easily transmitted in the broader community. So I appreciate that the numbers align today. But I think we're talking about two separate things here. They're both public health emergencies, without any doubt. And I say to the people who've lost loved ones, my heart goes out to you. But I also say to those who are still fearful that we need to do everything we can to suppress the transmission of COVID-19, that we're not out of the woods yet. I don't believe that we should bring these two things together, nor do I think that we need to separate them to get better outcomes. We are working as hard as we can. Minister Dix, Dr. Henry, also very attuned to the opioid crisis. In fact, my first meeting with Bonnie when she was first hired was about safe drug supply. So we've been working on this, trying to bring these numbers down. We've seen a spike in the past couple of months. It's very disturbing, particularly for those families affected. But I want British Columbians to know we are not abandoning them on this question. We're going to redouble our efforts to bring more resources, to bring more actions across the country, working with the federal government so that we can wrestle this to the ground just the way we have all collectively wrestled COVID-19 to the ground.